Hi, it's Erin. Welcome to the second video diary for the YoungMinds US fact-finding trip. It's Thursday night here at the moment, so I think it's kind of early hours of Thursday morning in the UK, and we're now in New York in our lovely apartment here. I've had 3 meetings since the last video diary. Hopefully I don't look quite as exhausted, but it's all been really exciting. The first of which was yesterday, quite soon after we touched down in New York. We flew from Portland in Maine, and that was with a fantastic guy called Len Bickman, who's a researcher and a developer of some software around feedback for child and adolescent mental health services. And I'm going to bring a whole load of information back about the program CFS that he developed. And the day after, so this morning, we went out to visit a service in the Bronx that's been working with the CFS program, and they're called Astor, and work between the ages of 2 and 21 and do a whole kind of range of services. And it was really interesting to kind of get a bit of insight into, you know, the way services in the Bronx work, but also what's been important about this feedback mechanism. Again, there's kind of no user participation in this service at all, but in some sections of the service, and it was over 2 sites, what they did talk a lot about was collaboration, and it was really inspiring to hear about the way that they look at collaborating during sessions, so the way therapists collaborate with young people to get better, basically, which I think was a really good model. And they were talking about some of the challenges of using this feedback software and collaborating at the same time, but that, you know, they thought that the two together could really work. And kind of the lead for the service was talking about the challenges that it took to kind of get everybody on board, and she talked around the metaphor of turning a boat around, and that it had to be an entire service change. We were asking the questions of, you know, if you're trying to make a change in the way clinicians work, is it better to focus on senior management and change it from the top down, or is it better to focus on kind of new clinicians and training a new generation from the bottom up? And she was saying both, really, and it's going to depend. But with the analogy of the turning the boat around, actually you tell everybody that you're going to be turning the boat around and this is going to happen, but you want to try and keep everybody on board. And undoubtedly some people are going to fall off, some people are going to jump off, and there might be some people you need to push off. And I thought that was quite a nice way of describing organisational change in mental health services. And the other thing about that service was, again, it was open access, and that was quite a recent thing for them, and it had been a real challenge. But it was interesting to hear, again, about how young people can refer from anywhere. And a funny thing kind of happened on that day and the evening before, and I think a fact-finding mission almost turned into converting people to participation. So the service are now thinking very seriously about how they involve young people more, and consequently Len is thinking about how he can make the software tool relevant for young people's feedback as well. So I guess flying the evangelical flag of participation in the US at the moment, which is a bit odd. And the meeting after was really exciting and was with some advocates. So we met with 3 family advocates who are all parents whose children have experienced mental health problems, and 1 youth advocate who was actually 30 but was talking about kind of a program of youth advocacy, which is essentially peer-to-peer advocacy for young people who are in the welfare system, or who are in the criminal justice system, or who are in mental health services. And they work out of family resource centres, the family advocates, and the youth advocates are part of that also. The lead for this work is in New York, so it's not a cross-country initiative, but what was really striking to hear was that they've got around 30 youth advocates, kind of from the ages of 17 to mid-20s, and that's to serve a population of 9 million, so it's kind of a really small project at the moment. but they're facing so many of the same issues of us, talking about how hard it is to get service on board, how some people don't see the value of young people's decision making. And I think it was exciting to hear about what they're doing because it's in a slightly different way, and I think we've got some stuff to learn from them. But it was also really nice to know that we've got something right, and actually I think we're leading the game here, and that VIK is one of a kind, so far anyway. So tonight I'm going to be facilitating a session with the rest of the group here, so from Anna Freud and from CAMS Outcome Research Consortium, and the Evidence-Based Practice Unit. And we're basically going to be looking at what's our learning been so far. I'm going to run them through a couple of exercises and looking at identifying what the key themes are. It should be quite fun. I'm going to get everybody on the floor with some post-it notes. It's I've had to listen to kind of stats and stuff all week, so it's my turn to get my revenge. And I'll do another video diary then to let you all know kind of how that went. And tomorrow morning we're off to Yale. And then I get a little bit of free time in New York, which is really exciting. So I'll have lots of pictures and stuff for you then. Okay, bye.